Roxanne Wilder with you. I am in St. Petersburg at Bay Dermatology, and I'm having the pleasure of talking with Dr. Richard Miller today. We're going to find out about some of the treatments, specifically Mohs surgery, when it comes to skin cancer. Great to see you today, doctor. Thanks so much.
Thank you very much.
So I want to find out about this, I shouldn't say latest, but this advancement, this Mohs surgery. What is it? Why is it effective for patients who've been diagnosed with skin cancer?
Mohs surgery, first of all, was designed or developed by a doctor named Dr. Mohs. That's how it got its name. And the main reason we use Mohs surgery is because it's the best way to cure skin cancer. And it also reduces the amount of skin we have to remove, so the scar after the surgery is less large than it would be if we just removed a large piece of skin. So Mohs surgery is a technique that we use the microscope with. We remove the cancer cells and then we look at whatever we think is the cancer itself under the microscope. So I look at a patient comes in, they have a skin cancer on their nose. Most of the time we do this on the face because we're trying to conserve the tissue enough to reduce the scar. So if I see a cancer on the nose, I'll look at it with my dermatoscope, which is like a mini microscope, and I can delineate the edges of the cancer visibly. But you can't tell microscopically how big the cancer is until you look under the microscope. So I'll take one layer of skin, not really one layer, one segment of skin of what I think is the whole cancer after it's anesthetized so the patient doesn't feel that. And then we take the piece of tissue we remove to the lab. A technician in the lab processes the skin so that I can look under the microscope at the slides of skin to determine if I removed the whole cancer or not. If I didn't remove the whole cancer, then I have to go back and take more. Usually it's just from one portion of the tissue that I remove, not the whole thing. So I go back just to where the cancer was still left and take another piece, look at it again. If it's clear, then we stitch it together. If it's not clear, then I have to take another piece. Most patients take 1 or 2 stages to clear. Sometimes it can take 5 or 6 stages depending on the depth and the aggressive nature of the tumor. But the cure rate for Mohs surgery is higher than any other option for skin cancer treatment.
So that is great to hear about that cure rate. I know it can be devastating and it can be scary to get that diagnosis, but to know that this option is available and the treatment is happening and getting great results. Patients want to know, what can we expect beforehand, during, and after, and then also in terms of pain involved?
Well, it's always a concern. Nobody wants to feel pain. And most of the cancers, as I said, are on the face. So the nerve endings and the sensory nerves of the face are very discreet and can be very painful if you're not careful. So you have to know how to inject the skin to anesthetize the area without hurting the patient too much. It's a minor pain if you do it correctly. You know, if you have to, we do it very slowly. The slower you inject the anesthetic, the less the patient feels. So the pain is minimized. I'm not saying it's painless. We can also put pain anesthetizing cream, pain relieving cream on the skin before we inject. You can put ice on the skin before you inject. There's ways of reducing the discomfort. So before we even do the injections, though, to numb it, we have to clean the skin with an antibacterial cleanser. We mark the tissue area. Like I said before, I look at the skin with my magnification. I delineate the cancer. I draw a circle with little notches around the edges so I can tell where I am when I remove it. You have to put little notches in the tissue at different segments of the piece of skin you remove so I can tell if the cancer is growing at 12 o'clock, I go back to 12. If it's at 3, I go to 3. So we take the cancer, we remove the cancer, but at the time, the pain is minimized because the anesthetic really reduces the discomfort. Now, when you're done with the surgery and you're all done, you're stitching it together, the pain when the patient goes home is minimal. The anesthetic lasts for about 2 hours. Patients are going to have some discomfort after the anesthetic wears off. Usually it's relieved just by a combination of over-the-counter Tylenol and Advil or ibuprofen. That's really all you need, and put ice on it and other instructions we give them, but it's not a terrible pain.
Dr. Miller, thank you so much for walking us through that, helping us understand. Of course, there are 8 convenient locations around our Tampa Bay area. To visit Bay Dermatology, you can call the number on the screen to make an appointment, or you can go to baydermatology.com and enjoy their 35 years experience in business. Been so great talking with you today, Dr. Miller.
My pleasure. Thank you for having me.